said this is the link. Please join me in the session. And today's topic is about posture, and we are going to talk about posture, then children and women. Uh, okay, children and women related participation in sports. Okay, so children and women, when we take up, first let us go for the posture related questions. Okay, so here postures, the health of a person depends on several factors: healthy nutrition, then cardiovascular fitness, and regular training are few of the better known factors that certainly change the human physique. Okay, so human physique depends on factors like healthy nutrition, then cardiovascular fitness, and then regular training. Okay, there is important element of physical change that is quite vital, that often goes unnoticed. That element is posture. Many people focus on balanced diet and regular exercise, which are very important, but often ignore the posture. The posture is important. Meaning of posture: the word posture from Latin verb uh, means to put or place. To put or place. Verb is ponere. Okay. So this is to put or place. The arrangement of the body and its limb is known as posture. The arrangement of body and its limb. The arrangement of the arrangement of body and its limb is known as posture. It is also considered as position of the body parts and way of bearing one's body. The good posture refers to three curves of spine in a healthy position. Three curves of spine in a healthy position. So this is the posture: cervical curve, thoracic curve, and then lumbar curve. So when you're writing about posture, you can draw this and you can have this shape. This is the healthy spine. Okay, this proper alignment of the body is important to possess a great posture. The spine is not straight, it has curves in the thoracic upper and lumbar lower regions. Okay, there are curves in the thoracic upper and lumbar lower. So this is the posture. Okay, it's not straight. Thoracic you have a curve, and lower region you have another curve, right? And then any deviation of any of curve from the original place leads to postural deformity. So if this is the curve, and in case um, any change or any deviation is there in this, it is called as postural deformity. A good posture refers to the stance which is attained when the joints are not bent and the spine is aligned and not twisted. Okay, the spine is aligned and not twisted. It is very essential for maintaining a healthy posture. Spine and muscle balance should be there. Healthy spine and muscle balance should be there. Sitting hunched over all day at desk can cause muscles to tighten. The placement of legs and spine, okay, how you are supposed to keep, hope you understand, right? Sorry, maybe this is a student, hope you understand the lesson which I am taking. Okay, under increased pressure and lead to the cleanliness of chance the leads to the chances of injury or strain. If a plumb line, okay, if a plumb line is hung from each earlobe in a good posture, the plumb line will drop straight down from earlobe, okay, lobe, through the shoulder area, down the middle of the arm, and through the ankle bone. So this you can see, right? So correct standing posture is this. This is the correct standing posture. Although standing is something we do every day, but most of us have never really given importance to the proper standing posture. Mm, okay, position. Many people are actually not aware that their standing habits can lead to their back and neck problems. Hence, it has become essential to know the correct standing posture. While standing, following procedures need to be taken care. The head must be kept straight. Okay, the head must be kept straight. It should not be tilted forward, backward, or sideward. The head should be straight. It should not be tilted forward, backward, or sideward. Okay, the ear lobes should be in line with the middle of shoulder. The ear lobes should be in line with middle of, okay, with should be in line with middle of shoulders. The shoulder blade should be kept back. Should be kept back. Shoulder blades should be kept back. Keep chest in a forward position. Chest in a forward position. Stretch the top of the head towards the ceiling. Okay, stretch the top of the head towards the ceiling. Keep the knees straight. The stomach should be tucked in. The pelvis should not be tilted forward or backward. The arches of the feet should be supported. So you can see this. This is the standing posture, right posture. Once again, you can see here, the head must be kept straight. It should not be tilted forward, okay, backward or sideways. The earlobe should be in line with middle of shoulders, and then the shoulders blade should be kept back, and then keep chest in a forward position. Stretch the top of the head towards the ceilings, and then keep the knees straight. The stomach should be tucked in. The pelvis should not be tilted forward or backward, right? And then the arches of the feet should be supported. And now this is the sitting posture, right? Sitting posture. Nowadays people sit for a long time on computers, hence the correct posture, sitting posture is also very important while reading or studying. In incorrect sitting position, it can lead to postural deformities. So this is the proper sitting position. Correct sitting position, you should sit straight. Okay, your head should be straight. And this is wrong sitting position, incorrect sitting position. For longer, when you sit in this position, see the spine here. Okay, for longer if you sit like this, it's incorrect. So how you are supposed to sit, right? I will tell you once again. You can just follow me. Okay, always sit up with back straight and shoulders back. The buttocks should touch the back of the chair. Okay, sit up with back straight and shoulders back. The buttocks should touch the back of the chair. All three normal back curves should be placed normally while sitting. As I said, this is the posture, and I told you the curves which you have. So all the three should be properly placed, and distribute the body weight on both hips, evenly on both hips. Okay, the knees should be bent, okay, at right angle. The knees should be bent at right angle. Keep the knees even little higher than the hips. Little higher than the hips. The use of a footrest or stool can be preferred. The legs should not be crossed. Always keep the feet flat on the floor while sitting. Try to avoid sitting in the same position for more than 30 minutes. So once again, the written one you can go through. Always sit up with back straight and shoulders back. The buttocks should touch the back of the chair. All three normal back curves should be placed normally while sitting. Okay, distribute the body weight evenly on both hips. The knees should be bent at a right angle. Keep the knees even little higher than the hips. The use of a footrest or stool can be preferred. The legs should not be crossed. Always keep the feet flat on the floor while sitting. Try to avoid sitting in the same position for more than 30 minutes. So, this is about sitting. So, what is the advantage of correct posture? Effective breathing. Okay, a good posture naturally enables to breathe properly. Good posture means that the lungs won't be squeezed, and this will improve thoracic capacity. This leads to good breathing. Okay, improves concentration and thinking ability. Due to better breathing, the thinking power increases as more power or more oxygen is also available to the brain. Great concentration and mental ability is there due to reduced pain and fatigue. Improves the personality. It improves also the personality. So these are all advantages of keeping the correct posture. Improves the personality. People with good posture look smarter and more attractive. A person having bad posture does not possess good looks. Good posture evokes grace and improves assertiveness in an individual. Increases self-confidence. A person possessing good posture becomes self-confident. He can walk, sit, stand smartly among the groups. Helps in avoiding orthopedic health complications. A good posture results in avoiding several complications such as increased risk of slipped disc, back aches, back pain, pressure inside the chest, poor blood circulation. Good posture also reduces strain on the spine. So hope most of the advantages are well followed by you all, and the last advantage is physically you are physically fit. Okay, you are physically fit when your posture is maintained. So you can see the postures at different ages. Okay, so with the age, when our posture goes down, we start looking old, right? So here with physical fitness, the optimal organ development and muscle function for maximum energy, endurance and vigor can be achieved in a person who possesses good posture. The correct alignment of joints and bones will result in less fatigue, and body will require less energy to move around. A person remains physically active. So good posture is good for you, right? Causes of bad posture. The causes of bad posture, one is heredity. Already you may have a heredity issue. So many postural deformities acquire from parents. The incorrect shape of spine can be due to genes. So heredity can be cause of poor posture only. So start doing exercises to make it fine if it is a heredity problem also. Okay. Age. The bad posture can be due to loss of muscle tone. When a person gets older, he loses muscle tone, and this leads to poor posture as shown in the picture. So do lot of exercise and stay young for long. Malnutrition also affects the age, malnutrition. First one is heredity, second one is age, third one is malnutrition, then fatigue, then obesity, low self-esteem, poor vision, then improper clothing, then sedentary lifestyle, occupational environment, like whatever we are working in for longer duration, then chronic injuries, then stress. All these things affects our posture. Okay, so malnutrition can lead to development of bone and muscle tissues. Low nutrition and lack of vitamins and calcium can affect the bones and muscles. This results in weakening of skeleton and can lead to a bad posture. Fatigue. Continuous overloading accumulates fatigue. In the condition of fatigue, it becomes difficult to hold the body in good posture. Chronic fatigue can cause the spine and shoulders to sink lower and worsen postures. Obesity, carrying extra weight around the abdominal area, can have problems with lower back being pulled forward by the weight of the stomach. Low self esteem, it is found that individuals possessing low self esteem often keep their head down and low shoulders forward. This can result in deformation of spine. It can become a bad habit and can lead to bad posture. Poor vision. Poor vision, it is found that poor eyesight may cause a person to lean forward to see the computer screen, book, or television. This leads to cause soldiers to hunch and head forward. Later, this causes bad posture. Improper clothing, it is established fact that tight clothing and improper shoes affect posture. The tight clothing results in incorrect sitting, standing, and walking. This habit can cause a bad posture. Then, sedentary lifestyle, the person who sits for a long without doing much exercise results in weakness of muscles and joints. Lack of active lifestyle can cause a bad posture. Okay, occupational environment is also very important to keep a good posture. People who work at a desk and sit incorrectly all the day have a risk of developing bad has a risk of developing and postural deformity, especially those who sit in front of computer for long hours, like tailors, tend to push their neck forward and hunch their shoulders, resulting in a bad posture. Chronic injuries like fractures, scapula injury, and all that will affect in postural deformity. When you experience pain in your back or neck muscles or any other part of the body, you tend to overcome the pain by holding your body in a different position. When this posture is continued for a long time, it can become a daily habit. Hence, holding yourself differently can be due to some pain or muscle injury in any part of your body can cause bad posture. Stress. The cause of stress can be physically or emotionally from work or any problem like family, then health worries. Stress initiates chemical responses in our bodies. Stress often yields chronic fitness, weight gain, and back weak bones. This leads to bad posture. So I have told you almost what all the bad postures, the various points. Even if you write 5 perfect points, you will get your good marks, right? And then later we are going to discuss about the different types of postural deformities. The deformities are like knock knees, flat foot, round shoulders, then lordosis, kyphosis, low bow legs, scoliosis. Okay, these are all deformities. So here you can see knock knee. Here the knock knee is derived from a Latin word genu and valgus. Means knee bent inward. The knock knee is also known as genu vallium. Okay, this is knock knee. This is flat foot. The arches are not seen. This is round shoulder. You get a hunchback. Okay, you can see this. Head is extended and the chin pokes forward. And this is lordosis, where normal spine when viewed from behind appears straight. However, in case of lordosis, the spine shows exaggeration of the lumbar region. Okay, so Lordosis is curvature of backbone vertebrae in the lower back area. Okay, there is a curvature here. Mainly lordosis affects the lumbar region. Okay, and then here lordosis is also mostly occurs in obese people who have weak back muscles and heavy abdomen. Okay, and then here kyphosis. Kyphosis is hunchback. Kyphosis is only hunchback. It is caused due to excessive curvature of the spine. When too much of curvature of the spine is being gets exaggerated, then it refers to as exaggeration of the outer or backward curvature of the mid spine. Kyphosis occurs on bow-legged because of their folded position in the uterus. The infant's bowed legs begins to straighten once the child starts to walk. The legs begin to bear the body weight. Severely bowed legs can be due to rickets. Ricket is caused by vitamin D deficiency. Okay, so there are people who get surgery and then correct it later stage, but better to walk correctly and make it fine at the early stage. Scoliosis is this. There is a S shape here. So remember, scoliosis is S1. Scoliosis is a disorder caused due to a abnormal curve of the spine. Already they have a abnormal curve in the spine. Backbone is in the lateral side. It will be in the lateral side. The spine has normal curves when looking from the side. So this is the scoliosis. Okay. So let me, how to correct it, I'll be saying it very soon. So these are the various ways of correcting it. The good posture displays level of fitness, and back exercise can be done, and then trunk exercise can be done, and then chest exercises, leg press, right? And then you can go for some aerobics. So these are, and for the knock knee, these are the exercises. Okay. So flat foot, your exercise is walking on the heel. Okay, and then for round shoulder, you need to stand, chest stretched, then supine chest, and corrective measures. Yes, ma'am. Corrective measures for lordosis is stretching. Okay, this is the stretching for lordosis. And this is the exercise for lordosis. For kyphosis, stretching while sitting on chair, cervical muscles, and these are all various exercises. And this is for scoliosis. Okay, so thank you for joining me. I'll come back to you.